Hello, I'm Tony DeMaria, the editor of JACC, here with a highlight from the June 18th issue of the journal. And this particular issue is dealing with the interesting question of a comparison of two second-generation drug-eluting stents, the zotarolimus-eluting stent from Resolute and the everolimus-eluting stent from Xience. And this comes from the so-called 20 study. And this is a study that was done in Germany that was a real-world study where patients were subjected to the use of one or other of these devices in a real-world setting. So lots of very complex lesions, some off-label indications, mimicking really a daily situation in a busy interventional laboratory. And the reason for publishing this study, which showed, in fact, that the two stents, the zotarolimus and the everolimus, were essentially equal in terms of their efficacy and in terms of ultimate target vessel failure, including revascularization or acute thrombosis. The reason for showing this, aside from the equivalence of the two stents in regard to those findings, was that dual antiplatelet therapy was rigorously employed for 12 months and abruptly stopped. So that, in fact, nearly 95%, just under 95% of the patients in this study stopped their dual antiplatelet therapy at 12 months as is the guideline. And what was found was that over a period of 2 years, the incidence of acute stent thrombosis was very, very low, 1.2%, 1.4%, not statistically different between the two stents. Importantly, very late stent thrombosis was extremely low, 0.3%, really almost non-existent. So I think the messages from this study are several. We have very good drug-eluting stents, second generation, to choose from. That the target vessel failure rate continues to fall to a very low extent using these second generation drugs. And importantly, in patients treated with dual antiplatelet therapy for 1 year, the subsequent incidence of acute stent thrombosis is very low and gets lower the longer duration of time from the implantation of the stent. For JACC, I'm Tony DeMaria.